atherosclerosis. I know that's a big word. That means hardening of the arteries.
Today to present to us on cardiovascular disease, and he's going to talk about nutrition and some of the ins and outs of cardiovascular disease.
You want the lights down in the car?
I think so. Yeah, well, thank you very much, Ms. Harris. It's a treat to be here. Appreciate your company. I'm at Baylor. Y'all know where that is. Most of the time I talk outside of Dallas. I try to point out there are two Baylors, one in Dallas and one in Houston. What I'm going to talk about is atherosclerosis. I know that's a big word. That means hardening of the arteries. There are a lot of heart diseases. There are probably 100 different heart diseases, but 99% of us, when we talk about heart disease, I think we're talking about atherosclerosis. And these are the plaques that fill up our arteries and cause them to get narrowed, and then the oxygen can't go to the various organs. Now this slide here has to do with cost of cardiovascular disease in last year, 1995. Most of this is due to atherosclerosis. But what you see here is that most of the cost of medicine, cardiovascular disease, is hospital expense. So if you can just stay out of the hospital, you save a lot of money. The red are the cost of drugs. Drugs are relatively inexpensive in the big picture. And then the green are all those physician fees, which in the big picture are relatively small. So staying out of the hospital is one of the least expensive things any of us can do. Well, now back to atherosclerosis. What I'd like to do here is to try to answer 6 questions. Now, you might look at some of these slides and say, well, that's not going to happen to me. But if you just look at that person next to you, one of you is going to die from atherosclerosis. I know it's the others, not you. This kills about half of us in this country, nearly half of us. The sad thing about atherosclerosis is that it's clearly hereditary in what percent of us? What would you say? Oh, mother and father had it, so therefore the children will get it. How often is atherosclerosis hereditary? Out of 100 people, how many have it because they've got bad genes? What? 10. The answer is 1 out of 500. 1 out of 500. So if you get atherosclerosis, or if I get it, most of us, we get it because of what we put in our mouths 21 times a week when we pull our chair up to the table. This is not a genetically determined disease except 1 out of 500 of us. Now, how much atherosclerosis is needed in the corneal arteries? The corneal arteries are the arteries which supply our heart muscle with blood. So, how much atherosclerosis is needed in these arteries to make this heart not function properly? Now, the answer to the question, and this slide is based on study of some people that we medically call acute myocardial infarction, and I suspect you would call heart attack. The person who suddenly has chest pain come on, usually at rest, and the chest pain persists, or pressure, or tightness under the chest. And then it hurts, it really hurts. You go to the hospital and they may sweat a little bit. You know something bad is happening. Then an electrocardiogram in 90% of people with heart attacks is very specific for that. And then there are some tests that we call enzymes, liver enzymes, which go up during a heart attack. So diagnosis, for the most part, is relatively easy. Now, what this slide tries to answer is how much narrowing is present in these arteries before we have a problem. Now, this slide is based on data from patients who died from heart attacks. But I can tell you, and this is relatively recent information, that those who live with heart attacks have the same amount of narrowing as those who do not live. In other words, you build up this plaque until you start having symptoms or problems from it. But from the time that you first start having symptoms to the time you die, the difference in the quantity of plaque present is very little, essentially none. Okay, these are the 4 arteries that supply the heart muscle. If you divide these arteries into little bitty segments and ask how many of these segments are narrowed to these degrees in cross-sectional area, it turns out that about 1/3 of the lengths of these arteries are narrowed over 75% in cross-sectional area. In other words, if you take a circle and divide it into 4 quadrants, over 3 of those quadrants are filled up by plaque. And that's the 1/3 of the length of these arteries. So if we stretch those arteries out, it's about that long. And that means 9 of them, or 1/3 of them, are narrowed severely. So the answer to the question, how much atherosclerosis is needed to cause symptoms of heart disease, the answer is a whole lot. Now that's both good news and bad news, of course. The good news is that it takes a lot of plaque before we have trouble. The bad news is, despite the fact it takes a lot of plaque before we have trouble, most of us, half of us, go on and acquire that sufficient quantity such that we do have trouble. Now, question 2, what do these atherosclerotic plaques consist of? Anybody? Anybody? Cholesterol. Anything else? No thoughts? Anybody? Throw it out. Fatty substance. Okay, now if I ask the physician group, I usually get the same answer. Now I'm not talking about plaques that occur in your 10-year-old children or your 20-year-old daughter or son. I'm talking about these plaques in people who are dead from atherosclerosis. Now, what this busy slide shows is this. You see the phrase fibrous tissue? What does that mean? That means scar tissue. And these plaques over here are little bitty plaques, and these plaques over here are big ones, such that these over here cause the lumen of these arteries to be totally occluded or virtually so. Now the answer to the question is what? It's fibrous tissue. This is acellular, and the red is cellular. And the amount of lipid material, that pultaceous debris, that green up there is cholesterol type stuff, is relatively small. The biggest proportion of the plaque consists of scar tissue. That is, if you cut your arm, it heals by a scar. And that's the same thing in these plaques. Now that doesn't mean that cholesterol is not the thing that's turning this process on. It is. I'll come back to that. Number 3, how many direct atherosclerotic risk factors exist? Now what's the key word in that question? Direct. Okay, I'll tell you what I mean by that. I mean, which factor or factors do you have to have in order to get atherosclerosis? Anybody? Do you have to have high blood pressure to get atherosclerosis? No. So it's not a direct atherosclerotic risk factor. Do you have to smoke cigarettes to get atherosclerosis? No. So it's not a direct atherosclerotic risk factor. Do you have to be obese? No. So it's not a direct atherosclerotic risk factor. Do you have to be a diabetic? No. What do you have to have? Well, but that's not a risk factor. That's a consequence of a risk factor. You have to have an elevated cholesterol level. Somebody asks me, Roberts, what causes atherosclerosis? I say cholesterol. That is the problem. Now, everybody knows this cholesterol level, don't you? You know yours? You don't? You know yours? You know yours? You don't want to know yours? It's a good insurance policy to know your numbers. A very good insurance policy. When you go to a doctor, and they do those numbers, write them down, keep them in your wallet, keep them in your purse. Somebody takes your blood pressure, write that number down, keep it. I mean, I go to a lot of receptions, people come up to me and go, I hear you're a doctor. My doctor tells me my cholesterol level is normal. And I say, what does your doctor consider normal? Oh, I don't know that. Just write your number down. It makes things easy to talk about. Y'all deal in numbers and barns here, don't you? I mean, in 1996, numbers are the key. Now, I call anything a total cholesterol over 150, I call that abnormal. Now, I'll bet you in this room there's only one person who has a total cholesterol less than 150. Anybody who does, raise their hand. You don't know. You don't know. That doesn't count. Now, what that means is that we're all candidates. We're all candidates. Pure vegetarians, what are their total cholesterol levels? About 135, 140. So can we do it? Of course. Now, when we're born, our umbilical blood, from baby to mother, you examine that blood, the total cholesterol at birth is 75. And then it shoots up in about 2 weeks of life to 150. And then it stays about 150, assuming we don't eat at McDonald's burgers every day, until we graduate from high school. And then it gradually goes up after that. In other words, if we could keep our numbers what they were when we were 20 years of age, the health of this nation would skyrocket. Now, the higher that number is after 150, the greater the risk. So if your number is 160, your risk is not anything compared to the person whose number is 240. Now, what if it's 300? The higher that number, and the longer that number has been present in the person, the greater the risk. So if somebody asks me, what causes atherosclerosis, I say an elevated cholesterol level, and my number for elevated is greater than 150. Now, this does not mean that high blood pressure is not important. Everybody knows that blood pressure, don't they? Our blood pressure at birth is 90/60. And in societies where they eat no salt, it stays 90/60 a lifetime. Does anybody here have a blood pressure of 90/60? 1, 2, better be nice to those folks. They're going to be around for a while. The importance of blood pressure particularly is that it's the cause of stroke. Stroke and cancer are about the two worst things. Stroke can be prevented. You got to keep your blood pressure down. And in this nation, we call 140/90 the upper limit of normal. But if you look at 140 compared to 90, or 90 compared to 60, that's quite a high percent. We eat too much salt in this nation. The more salt we eat, the higher the blood pressure. I used to sit down at the dinner table and just pour salt on what I was going to eat before I ever took a bite of it. And my blood pressure started going up. I said, this is crazy. So I went, quit. After 1 month, I didn't want that salt anymore. I can't stand the stuff. It's what you get used to. Okay.
What is recommended? I mean, what do you recommend? Like, you recommend 150 for the cholesterol. What do you recommend to keep your blood pressure? Is it 90/60, or is there?
Well, I recommend several things. Number one, stay at ideal body weight. That's the best thing you can do for your blood pressure. If you're at ideal body weight, the chances of having hypertension are not very good. Number two, although I have an alcoholic drink periodically, if you overdo it, alcohol raises blood pressure. Exercise lowers blood pressure. So staying in good condition, particularly when the exercises are things like walking fast or running or swimming, not weightlifting. Weightlifting raises blood pressure, although it's transient. So there are things we can do to keep our blood pressure down, but we all eat too much salt in this nation. None of us should eat. We should all eat less than 2 grams of sodium every day. Salt is sodium chloride. The bad element there is the sodium. The average American eats 10 grams of salt every day. None of us should eat more than 3. And the fewer we eat, the lower our blood pressure. Now, what factors indicate that cholesterol causes atherosclerosis? The one thing for you to remember in this room when you leave today is that if you want to prevent atherosclerosis, you get your number to 150. If you have it, if it's higher than that, and you bring it down to 150, you can take away the plaques that you already have. That's pretty good news. We didn't know that 5 years ago. What factors indicate that cholesterol causes atherosclerosis? Anybody know the answer to that? If you had a jury of 12 jurors over here, and you had to convince them that the cause of atherosclerosis is cholesterol, what factors would you throw to them? Well, these are the ones that I put to them. And all this started in 1908. A Russian physiologist fed, what they did first was they fed raw red meat, and then fat, and then pure egg yolk, which is essentially cholesterol, to certain non-human animals. Which ones did they choose? Dogs? Cats? Monkeys? Well, they chose rabbits. Now, the reason is you can only produce atherosclerosis in an herbivore. You can produce it in a monkey. You cannot produce atherosclerosis in a dog or in a cat. You cannot produce atherosclerosis in a carnivore. Now, if you take a human being and constantly pour down cholesterol and fat, can you produce an atherosclerotic plaque? I hear yes over here. Anybody else? Yes? Yes. The answer is yes. Half of us are going to die from atherosclerosis. And yet, carnivores don't get atherosclerosis. Herbivores are the ones who get atherosclerosis. And human beings get atherosclerosis, so what does that mean we are? Herbivores. And what are you going to have for dinner tonight? Meat. Okay. So we determine whether we get $499 out of $500. Now, I just had lunch and I had a tuna salad sandwich. So I'm not pure. I was a vegetarian for 18 months, and I eat out a lot. It's hard. I eat fish now, but that's the only flesh I eat. So if you're going to prevent atherosclerosis, if you go home and eat these 8-ounce steaks, or if you go up to Amarillo and eat one of these 50-ounce steaks, that is not what herbivores eat. And we are fundamentally herbivores, and if you want to be healthy, the closest you can come to that lifestyle, the healthier you will be. If you you have to stop in the fast food chain on the way home, you are telling yourself where you're going to end up and what disease is going to get you. Okay, this started in 1908 when Russians fed some rabbits fat and cholesterol and so on, introduced atherosclerotic plaques. Just like those that occur in you and me. The second thing that happened, the biochemists came in and they saw these plaques in these arteries and they plucked them out and they ground them up, and lo and behold, there was cholesterol in these plaques. The third thing that happened was after World War II. There was a very prominent man named Ansel Keys. You ever heard of the key rations during World War II? Most of you are too young for that. Ansel Keys is a vegetarian. He's 92 years old. He lives on the French Riviera. He's healthy as he can be. Ideal body weight. Does whatever he wants to, 92 years later. Now he and his group went to some countries around the planet, and they examined a lot of people in each of these countries, and they found that some people had no evidence of heart disease whatsoever, and others did. And then they did blood pressure tests and cholesterol tests and smoking and analysis and all that, and found that those who had atherosclerosis had total cholesterol levels greater than 150. Those who didn't, essentially lower than that. Then these items here, 4, 5, and 6, were really solidified the last decade. And that is, the higher the blood total cholesterol level, the greater the chance of having symptomatic atherosclerotic disease, the greater the chance of dying from it, and the greater the extent of these plaques at the time of death. Now, item 5 took you and me, as taxpayers in the USA, a lot of money to get the answer to a simple question. The question was, if you take a large group of people with very high cholesterol levels and no evidence of heart disease, and if you reduce those levels down to here, will you decrease the frequency of occurrence of heart attacks? And what's the answer? Yes. You, as Americans, spent $160 million to get the answer to that simple question. Number 6, and this costs a lot of money also. If you take a group of people with cholesterol levels up here, and all of them have had heart attacks, and you take those cholesterol levels and you bring them down to here, will you decrease the chance of a second heart attack compared to the group who didn't bring them down? And what's the answer? Yes. A resounding yes. Now, these are the cholesterol levels that are very, very high in the USA. Now, this is total cholesterols greater than 240. Well, that's a very high. And these are the various age groups down here on the horizontal axis. And what we see is that earlier in life, men, shown here in yellow, have a higher percent of these higher levels than do women. Actually, men sort of go to pot between 35 and 40. It's a disaster. Now look here, ladies, don't laugh too loud. After menopause, women have a higher percent of these higher levels than do men. Now, it may be one reason that women have a higher percent is that the men who had higher levels early in life are no longer available to be studied. Now, ladies, you have a 1 in 9 chances of having cancer of the breast. 1 in 9. You have 1 in 2 chances of having atherosclerosis that can kill you. Now, everybody knows that total cholesterol, which is what I've been talking about, is not the whole picture. Total cholesterol equals the HDL cholesterol, which is the good one, you want that to be as high as possible, plus the LDL cholesterol, which is the lousy one, that's the bad one, that's the dangerous one, plus the triglyceride level divided by 5. Now, what we see here is that the HDL, the healthy one, the good one, stays about the same most of our life. 20 and 75, and most of us, it's about the same. And women have a higher level throughout their lives than do men, as a rule. The LDL cholesterol, the lousy one, is higher in men earlier in life and higher in women later in life. The reason the total cholesterol tends to go up after age 20 is why? What? Now, which portion of the total cholesterol goes up? The LDL. The HDL stays more or less the same. The triglyceride doesn't vary too much. Well, the triglyceride is all over the place. But the reason the total tends to go up after age 20 is primarily because the LDL, the bad one, goes up. Now, this is Ansel Keys of Key Ration fame. This is a study he started in the 1950s. Most of this data was collected in the 1960s. They went to these 7 nations, examined over 13,000 people, and found that the frequency of symptomatic coronary artery disease, which means atherosclerosis in these coronary arteries that supply our heart muscle with blood, was very low in some nations like Japan and Greece, and very high in the USA and Finland. At that time, only 10% of the calories that the Japanese were eating were coming from fat. 10%. That's a vegetarian diet. In Finland, on the other hand, about 45% of their calories were coming from fat. And what did Ansel Keys find? He found that the people in Japan had a total cholesterol averaging approximately 150, and in Finland, it was approaching 300. He concluded in the 1960s that this was a cholesterol problem. We didn't pay enough attention to it. Now, this is a study published in 1986. And the reason it's important, do you have a pointer by chance? Pointer? Got a yardstick?
I'll go get you
We
one.
got a long arm? Now, the reason this study is important is that over 350,000 people were examined. Now, these were all men, sorry ladies, aged 35 to 57 when they entered the study. They were all asymptomatic, that is, they had no evidence of heart disease. And they were divided into 10 groups according to their serum, that's their blood, total cholesterol level. And what we see, as that level goes up, 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 and up, the coronary artery disease mortality, that's death from atherosclerosis of the coronary arteries, goes up, 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 and up. No study shows it better, that total cholesterol is quantity. The higher the quantity, the greater the risk. Know your numbers, folks. Keep them in your wallet, keep them in your purse, put the date that they were recorded. The next time you get it done, record it there, just like you keep in your checkbook. It's your health book. Now, there have been 2 studies now taking a group of people with high cholesterol levels, no evidence of heart disease things. I'll try to remember to give it back to you.
Okay.
I forgot to give one back. One time I left it on the podium, and the person billed me $140. But I don't have that point. At any rate, what what these primary prevention trials show, and that is when you're studying a group of healthy people. If you look at their total cholesterol value, if it lowers 10%, you decrease your chance of a heart attack by 30%. So every 1% drop in total cholesterol you get, if you're asymptomatic, you get a 3% reduction in heart attack. Now let's say your total cholesterol is 200. If you drop that 10%, that means dropping it to 180. You decrease your chance of a heart attack by 30%. That's the kind of company I want to work in, invest in. And of course, the opposite occurs. You raise your total cholesterol by 10%, you raise your chance of a heart attack by 30%. So it goes both ways. And we determine that. You and me, when we pull our chair up to that table 21 times a week, that's when we determine our cardiovascular health. Now this is a busy slide here, and the only reason I show it is that it used a statin drug. I'll come back to the drugs to lower cholesterol, but the statin drugs are by far the best one. We have some magical drugs now, and they're all called statin. That's the last 6 letters. But what this study show, and studying some people who had no evidence of heart disease, and they decreased their cholesterol levels a great deal, and compared them to those who didn't do it. And they had a marked reduction in heart attacks, in deaths, and deaths from all causes, any kind of death. You lower that total cholesterol well enough, and you decrease your chance of dying from anything you want to name, not just heart disease. Now this is a busy slide, I apologize, but this is the best study that we call secondary prevention trials. Now what these trials are all about is that you take a group of people who've already had a heart attack. They've been in coronary care units around the country. And their cholesterol levels are up here. And then you put them on these cholesterol-lowering drugs or twist their arm and get them on a vegetarian diet. And then their cholesterol levels are brought down to here, and you compare them to those people who didn't bring them down. And the frequency of subsequent heart attack decreases enormously. Look at this, 42% reduction. This means risk of revascularization procedures. That means, y'all all heard of bypass operations, coronary bypass operations? Very common operation, 400,000 in this country last year, very expensive. Have you heard of coronary angioplasty? Put a catheter in, blow up a balloon? That's what these revascularization means. That means it's going to, if you take these cholesterol-lowering drugs, you decrease your chance of having these expensive procedures by a great deal. And these studies were done in 5 Scandinavian countries. And they don't do as many of these procedures as we do over here. This would be a 50% reduction in this country. That's how we save money, folks. You don't save money by going to your doctor. You save money by changing what you put in your mouth 21 times a week when you pull your chair up to the table. Your health is dependent on you, not your physician, not your hospital, etc. Now, we have 17 studies now that show that after you've had a heart attack, and if you inject contrast material into the coronary arteries, and so you have a baseline, and then you take a group of these people and you put them on a cholesterol-lowering drug, and the other group you just follow. Regression means that plaques shrink. They get less. And in the treatment group, it's red. And every one of these studies, except the first one, showed the same thing. That is, if you have a heart attack and you have a cholesterol level here, and you bring it down to here, you not only decrease the chance of a subsequent heart attack, but you shrink the plaques. It's a miracle. How does it work? If you have a heart attack, you have one or more arteries that are narrowed greater than 75%. That is, over at least 3 plaques are obliterated. And if you lower your cholesterol level, some of this cholesterol material can shrink, and then the lumen might open up so that it is now narrowed less than 75%. And it's an engineering miracle, at least to me, that if an artery is narrowed less than 75%, that is as if there's no plaque at all. In other words, you get just as much flow through here as you would as if the whole thing was open. That's a miracle. Okay, progression means plaques get bigger during this period of time. And if you look at the treatment group, the plaques did not increase nearly as much in size as in the non-treatment group. Now, even more important than that, if you had a heart attack, you don't really care too much whether your plaques get bigger or whether the plaques get smaller, but just don't let me have another heart attack, right? Okay, what these studies show that if you have a heart attack and you start taking these cholesterol-lowering drugs, you can decrease your chance of another heart attack by nearly 90%. That's another miracle. See, we are in the stage now, not of decreasing the risk of heart disease. That's what we've all been talking about for 50 years, decreasing the risk. We now have entered the period that we can prevent atherosclerosis. And number two, if we already have it, we can arrest it. We can prevent any new plaques forming. How do we do that? We get our cholesterol levels to 150 or less. What's the answer to that question? How can symptomatic atherosclerosis be prevented? And if present, how can it be arrested? I just told you the answer. To what? 150 or less. So when you're 290 and you lower it to 280, you lower cholesterol. That's not what we're talking about. We're talking about reaching a specified number. That's very different than lowering your cholesterol. Okay, question 6. How can normal cholesterol levels be prevented from rising, and how can elevated levels be lowered to normal? What do we do? What do we got to do?
Like the rabbit.
Eat like a rabbit. That's good. Okay, we got to do 3 things. We've got to decrease the quantity of cholesterol we take in. We've got to decrease the quantity of saturated fat we take in. And we've got to decrease the quantity of total calories we take in. 3 things. This is cholesterol. 3 different studies. They all show the same thing. As we increase our cholesterol intake, the cholesterol in the blood goes up. Simple as that. You go home and eat 3 eggs, your chances are your cholesterol is going to go up. Now, there are few of us that can eat 3 eggs, and lo and behold, it doesn't change. So there is an individual variability in how we respond to cholesterol intake and fat intake. But in groups of people, the more we take in, the more it is in the blood. Now, actually, I don't worry about cholesterol too much. Most of us take in about 500 milligrams. And how do you picture 500 milligrams? Does that mean anything to you? Y'all use metric numbers around here? So it doesn't mean anything to you, does it? Well, it's just the bottom of a thimble. 500 milligrams is not even a gram. Very small, not even enough to get a calorie out of it. Most of the cholesterol, all of the cholesterol we take in comes from animals and their products. So if we quit eating animals, cholesterol is a non-issue. Eggs. Half the cholesterol we take in comes from the visible and the non-visible eggs we eat. And the visible ones are only half of the eggs we eat. Salad dressing, cookies, all the rest loaded with sugar. Now, the second biggest source of cholesterol are cows. Now, we call it beef, but it's really bovine muscle, and then milk, and then cheese and butter. So if we quit eating eggs and quit eating cows, the cholesterol issue is a non-one. Now, fat. This is a real bugaboo. The average American takes in over 100 grams of fat. In Texas, I would say the average average fat intake for Texans is 150 grams every day. A deck of cards weighs 75 grams. None of us should eat more than a deck of cards of fat every day. That's 75 grams. But we would all be far healthier if none of us ate over 50 grams of fat every day. Now, what's the problem with fat? Got a lot of calories in it. The major problem with fat is about a third of it is saturated. Now, saturated fat, if you eat a lot of saturated fat, your blood cholesterol goes up. Now, why is that? The answer to that question is not entirely clear. The way I think about it is that when you take in saturated fat, when it enters your body, it's essentially converted into cholesterol. So our biggest source of cholesterol is not that we take in directly through that by eating cholesterol, but that which is converted to cholesterol through the saturated fat channel. Now these things over here we got to avoid. Look at coconut oil, palm kernel oil, that's 90% saturated fat. That's the pits, that's all. Butterfat, 66% saturated. Beef tallow, over 50% saturated. Now these over here are the good ones. All of them have all three in it. But see, monounsaturated and polyunsaturated either lower our total cholesterol or they have a neutral effect. Saturated clearly raises our cholesterol level. Now there's some evidence that monounsaturated is better for us than polyunsaturated. Look at olive oil, 77% monounsaturated. I was in Italy a couple months ago and went to this couple's house, and they don't even buy butter. They don't even buy margarine. They put olive oil on everything. They cook an egg, they cook it in olive oil. They have to put something on a piece of bread, they put olive oil on it. Now, if you want to get a good grease job quickly, there's no better place than the fast food chain. And as you know, 1 out of every $2 spent for food eaten outside the home in the USA is spent in a fast food chain. Now, these are the ingredients of some of the hamburgers. The Carl's Jr. Double Western Bacon Cheeseburger, folks. That's the Cornell Arteries bypass special. Burger King double beef whopper with cheese and Jack in the Box Ultimate Cheeseburger. We're talking about approximately 1,000 calories in that hamburger. And you take that sucker and squeeze it real hard, and you'll come up with about 15 teaspoons, not grams, but teaspoons of fat in that single hamburger. Now this word here, sodium, not sodium chloride, not salt, but sodium alone, we get about 1,800 milligrams of sodium in that single hamburger. I'll have the half-pound double deluxe bacon steel burger, please. You want chemotherapy? Now there was a book that appeared a while back entitled In One Day. And the author asked the question, what do we consume in the USA every 24 hours? Well, about 815 billion calories of food, roughly 200 billion more than we need. Now those 200 billion left over would feed the whole country of Mexico every day, no problem. In 1960, folks, we reached 60%. 3 out of every 5 adults in the USA are overweight. Look around, 3 out of every 5. In this country, we kill about 100,000 cows every day, and they give us about 60 million pounds of red meat. Now, we do it differently in the USA than the rest of the country. As you know, we've got about 260 million people in this country and 100 million cows. And we kill about 100,000 of them every day. And in the USA and Canada, we bring them into these feedlots. They'll last 5 to 6 months of life. And why do we do that? We do that so we can feed them 20, 25 pounds of grain and soybean. And why do we do that? Because it makes them fat. And the fatter they are, the better they taste. And then we kill them, and then they kill us. That's the way the system works. about 85% pure fat. Now, if you don't know what it is, make a hot dog out of it. We eat about 47 million of them every day. We eat about 50 million pounds of sugar every day. We drink about 16 million gallons of beer and ale and 1.5 million gallons of hard liquor, enough to make 26 million Americans thoroughly drunk every day. About 3,000 or 4,000 teenagers take up smoking every day. I like this statement by William Collins. He says, "The carnivore animal has almost an unlimited capacity to handle saturated fats and cholesterol, whereas the vegetarian and herbivorous animals have a very restricted capacity to handle these food components. It is virtually impossible to produce atherosclerosis in the dog, even when 100 grams of cholesterol, now that's 200 times the average daily intake for humans in the USA, plus a quarter of a pound of butterfat are added to its meat ration. In contrast, adding only 2 grams of cholesterol daily to a rabbit's chow for 2 months produces striking fatty changes in its arterial wall." Now, we more like the rabbit or more like the dog? Well, now when you look down at your appendages, do you see claws or do you see hands we're supposed to be using for gathering these fruits and vegetables we're supposed to be eating? Now, there are those who argue, well, these teeth in the front of our mouth, they're sharp, so we're really omnivores, but most of our teeth are flat for grinding these fruits and vegetables. Now, the intestinal tract of a human being is very long. The small intestine, if you stretch it just a little bit, would extend from this wall all the way over to that wall. Small intestine of a human being is very long. The small intestine of a carnivore is very short. You give your dog or cat something to eat, they got to go outside in a few minutes and do their thing. You know, they have a very short intestinal tract. Now, when you cool your body, do you pant like a dog or do you sweat? When you drink water, you lap it like your cat or do you sip it? I don't know any human beings that make their own vitamin C. We, of course, obtain it from our diet. Folks, I think we think we're one of these carnivores, and we certainly conduct our lives as if we were, but I would suggest, as have many others, this is where we are, right over here. And the closer we get over here, the greater our health. That's the best insurance policy that you can ever buy. There are certain diseases that pure vegetarians rarely get. I'm not talking about a vegetarian for a day, a week, a month, or a year. I'm talking about one for several decades. They rarely get atherosclerosis. It's going to kill one half of us in this room. They rarely get it. Blood pressure, they rarely have high blood pressure. We have 60 million Americans with blood pressures greater than 140 over 90. Pure vegetarians, they don't get it. Look at this, ladies. Cancer of the breast, very uncommon in pure vegetarian societies. About 5% of people with cancer of the breast, it's hereditary. 95% it's not. Cancer of the colon, a major cancer in the prostate gland, particularly in men, very uncommon in pure vegetarian societies. Diabetes after age 50, they don't get it. They're not obese, they're not bothered by peptic ulcer, constipation, hemorrhoids, diverticulosis, appendicitis, irritable bowel syndrome, hyaline. Look at this. Gallstones, kidney stones. Ladies, osteoporosis. Probably a problem of taking in too much protein. The more protein we take in, the more calcium we lose in the urine. This slide has to do with when we die. The authors call it mortality ratio. It means just when we die. And whether you're a man or whether you're a woman, the more we weigh, the sooner we die. And we can all point out to Winston Churchill's, but they are the exception. In groups of people, the more we weigh, the sooner we die. This has to do with overweightness in the with obesity in the USA. I've already mentioned that 60% of our population over age 18 are overweight. And I'm talking about a subset of that. The subset meaning those who are frankly obese. Now, obesity is defined medically as greater than 20% over ideal body weight. And in other words, if you're supposed to weigh 160, you weigh 200. So this is a lot of weight. Now look at this. Black women in this nation, about 45% are not overweight. They are overweight, but they are obese. In the white population and in black men, it's about 25%. No nation in the history of planet Earth has seen the problem of overweightness and or obesity that we face in this nation. It's unique to the rest of the world. You go to Europe, you go to Asia, you don't see problems of obesity that you see daily in this nation. It's a major problem. This slide has to do with cancer of the breast. Well, why is he talking about cancer of the breast? Well, on the horizontal axis here are the grams of fat we take in every day. About 140 grams, a little over. Here we are, USA. We have one of the highest frequencies of cancer of the breast in the world. But this slide could just as easily be cancer of the colon. It could just as easily be high blood pressure. It could just as easily be atherosclerosis. The lower the quantity of fat consumed by any society, the lower the frequency of our two most common cardiovascular conditions and two of our three most common cancers. Can we do something about our health? Yes. And the government is not going to do something about it. We have to do something about it. Your doctor can make you just a little healthier. But if you're really going to be healthy, you determine it. And when you pull that chair up to the table 3 times a day, 21 times a week, you determine whether you're going to get atherosclerosis, cancer of the breast as a rule, cancer of the colon, cancer of the prostate gland, gallstones, kidney stones, osteoporosis, osteoarthritis. This has to do with World War II. During World War II, 1939 to 1945, there was not much red meat available in certain countries, and not much butter, not much cheese, and not much milk. And what happened to the cardiovascular death rate? Well, in Sweden, boom, it fell. In Finland, boom, it fell. In Norway, boom, it fell. In the USA, it just kept on going. Can we change our health? Of course we can. Okay, this is diet. The most commonly prescribed diet in America by physicians is 30% of fat from calories. 30% of calories from fat. That's a good start. But if you're really going to decrease your cholesterol level by diet alone, you've got to decrease your percent of calories from fat from 40% to about 20%. And then you get about a 20% reduction in your total and LDL cholesterol level. This only lowers your LDL in total about 5%. Now these are the drugs presently available for cholesterol lowering. The statin drugs are these four at the bottom. And STATIN, those are the things. All of these work the same way. They're all excellent drugs. The difference between them is primarily one is more potent than another. But I think these drugs are very safe and they are enormously effective. Look at this. These drugs at high doses can lower LDL cholesterol levels up to 44%. Total cholesterol up to 36%. Triglycerides down about 25%. They can raise the good cholesterol up 8 or 10%. Wonderful drugs. Just don't eat so much meat and have some money left over to buy some of these drugs. They're very useful. I've gone to high dose of these drugs. Low doses, you want to get that LDL cholesterol. If you get that under 100, generally the total is under 150. So that's the number you want to shoot for, and you can't get those low doses, you can't get those low levels with low doses. You get them at high doses. So I'm a high dose person. And it turns out that for every 4 people put on these drugs, 2 quit taking the drug within a year, and then 3 quit taking it within 2 years. So it's not enough just to start on the drug. You got to keep on the drug. Doesn't make you feel better, but it makes your health better. Now, who should be on these drugs? Certainly anybody who has symptomatic heart disease. So if you've had a heart attack, you ought to be on these drugs. If you've had bypass, you ought to be on these drugs. If you had an angioplasty, you ought to be on these drugs. Now, if you have the familial variety, you should be on the drug. Because no diet, vegetarian diet or whatever, is not going to bring your cholesterol down adequately. People with asymptomatic but definite evidence of atherosclerosis, they should be on the drug, in my view. if I had diabetes mellitus, I would clearly be on one of these drugs to keep my cholesterol very low, because atherosclerosis is the biggest cause of death in diabetics. Only 2 million Americans are on these cholesterol-lowering drugs. We have 40 million Americans with total cholesterols greater than 240, 40 million. We have 2 million on these drugs. We have a bottomless pit. We have 7.5 million people in this country who've had heart attacks. We've had a lot of others who've had peripheral vascular atherosclerosis or carotid artery atherosclerosis. Very few of them are on these cholesterol-lowering drugs. We have the weapon now to treat this disease. These statin drugs are to atherosclerosis what penicillin was to infectious disease. Now, physicians and patients had no hesitancy in taking penicillin when they had an infectious disease. But everybody has a problem in taking these drugs. And if you have a problem, don't be afraid of them. They're good drugs, and they are the best insurance policy that you can buy. I'll end with this slide. These are Cornell Arteries in a woman who was 103 years of age. 103. This is our left main corneal artery right now. Perfect. I trade with her right now. This is the one in the front of the heart, the left anterior. It's beautiful. Now, the reason I show this is simply to point out that we don't have to have atherosclerosis just because we get older. This is not a degenerative disease. We are the degenerates. Pure vegetarians don't get this disease. This poor woman was run over by an automobile. That's it, folks. Remember, 150, 150, 150, and you won't have to worry about heart